Chickenpox. Synonym: varicella. Causative agent: Varicella-Zoster virus. Human alpha herpes virus-3. Incubation period: 14 to 16 days. Source of infection: case, person-to-person contact. Mode of transmission: air droplets, respiratory. Period of communicability: 1 to 2 days before to 4 to 5 days after appearance of rash. Secondary attack rate: 90%. Chickenpox rash. Dewdrop on rose petal appearance. Centripetal distribution. Pleomorphic rash. Superficial and unilocular. Inflammation around vesicles present. Affects flexor surfaces. Involves axilla. Spares palms and soles. Rapid evolution. Scabs form after 4 to 7 days. MC late complication of chickenpox. Shingles, caused by reactivation of the virus decades after the initial episode of chickenpox. Most rapid and sensitive means of diagnosis: examination of vesicle fluid under electron microscope. Shows round particles. Live attenuated chickenpox. Monovalent vaccine. Strain: Oka strain. MMRV combination vaccine. Age group: 9 months to 12 years. Minimum interval between 2 doses: 4 weeks. Chickenpox is a systemic viral infection with a characteristic rash caused by Varicella-Zoster virus, a VZV, a herpes virus. Its public health importance lies in the risk of complications in immunosuppressed and pregnant patients, and the potential for prevention by vaccination. Herpes zoster, shingles, is caused by reactivation of latent VZV, whose genomes persist in sensory root ganglia of the brainstem and spinal cord. Epidemiology. Chickenpox occurs mainly in children. Clinical features. There is sometimes a prodromal illness of fever, headache, and myalgia. The diagnostic feature is the vesicular rash, which usually appears first on the trunk. They start as small papules, develop into clear vesicles, which become pustules and then dry to crusts. There were successive crops of vesicles over several days. The hands and feet are relatively spared. A more fulminant illness, including pneumonia, hepatitis, or disseminated intravascular coagulation, may affect the immunocompromised, neonates,
functionally healthy adults, particularly smokers. Congenital varicella syndrome occurs following infections in the first 5 months of pregnancy, although most risk appears to be in weeks 13 to 20. Herpes zoster begins with pain in the dermatome supplied by the affected sensory root ganglion. The trunk is a common site. The rash appears in the affected area and is vesicular and rapidly coalesces. It is very painful and persists for several days and even weeks in elderly people. Transmission. Man is the only reservoir. Carriage does not occur. Chickenpox is highly infectious. Herpes zoster very much less so. Transmission is by direct person-to-person contact, by airborne spread of vesicular fluid or respiratory secretions, and by contact with articles recently contaminated by discharges from vesicles and mucous membranes. The risk of transmission is high. The attack rate in susceptible exposed children is 87%. Acquisition. The incubation period for chickenpox is 11 to 21 days, usually about 15 to 18 days. Cases are infectious for up to 5 days before the onset of the rash, usually 1 to 2 days, until 5 days after the first crop of vesicles. Infectivity may be longer in immunosuppressed patients. Most transmission occurs early in the disease. Prevention and cure. 1. The patient should be kept in isolation. 2. Clothings, utensils, etc. used by the patient should be sterilized. 3. Fallen scabs should be collected and burned. 1 attack of chickenpox gives lifelong immunity to the person recovered from this disease.